Good evening, everybody. This is Conversations with your nurse advocate. Pam and Linda are here for episode number 11 already. And we're going to visit with Karla Wilson. She's a board certified music therapist, and we're going to learn about her business and just learn a little bit more how therapy helps with people with chronic diseases. So Karla, welcome.
Thank you so much. It's a pleasure to be with you.
So how do you become a board certified music therapist?
Oh, that's a great question. So you are required to have a college degree. So it needs to be a degree in music therapy. You have to complete a full-time 6-month internship. And that needs to be in a setting that's supervised by a board certified music therapist and that's been approved by our certification board. And then following that, you do take a certification exam. And when you pass it, you're good to go. However, just like your profession and so many other healthcare professions, we are required to have 100 hours of continuing education every 5 years. So that's a process that's ongoing for us, the learning process.
So this is so fascinating to me. So what is the curriculum like so what do you learn as a music therapist?
Sure. Well, I know one thing that it has changed a little over the years since I studied, but there's, obviously the core of music, because you have to be an excellent musician, really, to be a music therapist. It's not, because of the fact that you have to be providing music of so many genres, and you have to be able to do that, and you have to be able to do it in a way that's pleasing to the person that you're working with and whatnot. So there's definitely all of that piece, and you have to be able to perform on an instrument and pass juries each and do a recital at the end of your senior year, that sort of thing. But then there's also the sciences, lots of sciences, and psychology, sociology. When I was studying, although I don't think they do this now, but we were required to take acoustics, definitely anatomy and physiology. We have to have a good understanding of the body in order to understand the disease processes of the individuals that we work with. Mm-hmm. So that's really, in essence, the core of the curriculum. And then not to diminish the fact that then you're taking your music therapy studies as well, those courses, lots of those. And you have clinical experiences during your education process too, before you hit the internship level too.
Awesome. Well, I just want to say hi. It looks like we've got some people watching tonight, so that's good. So what kinds of clients do you service? What different types of diseases or what types of patients do you find that you can benefit?
Sure. In my business right now, I'm working with individuals who have neurological diseases and conditions. So I'm working with folks who have dementia, various forms and different phases, of course, of the dementia spectrum. And I've worked with individuals who have Parkinson's disease and MS and those types of things as well. Some of the, I have also worked with individuals who have disabilities developmentally and intellectually. So there's that category of folks too. And then children. I've done a lot of work with children who have medical complexities, and that's something also that's very dear to my heart. There's actually I can't think of a client population, so to speak, that I don't love to work with, really, because each one pulls out something different, something unique from me that I can be able to give to them. I'm trying to think if I've missed anyone. And hospice.
Okay, just going to ask about
that. I can't believe I missed that one because I've spent so much of my career working in hospice. But that's definitely a population that I dearly love to work with, and I feel that music therapy can benefit in just so many different ways.
So tell me, Karla, what benefits do you see? What are the changes, or what do you see, or how do you see your patients or your clients change as a result of getting music therapy?
Okay. Well, I think it would help for you to know a little bit about the process, how we get from point A to point B. We start out with an assessment. So each person that I meet that first time, sometimes it takes more than one session to really get a feel for the patient's interests and their needs and their preferences. But looking at that initial assessment, then I can pull out and of course work with the patient and or family to determine what are the needs that they'd like to see addressed. Okay, so maybe high anxiety is an issue for someone. Maybe pain is an issue for somebody. For those with dementia, I'm finding out, of course, cognitive issues are an issue, and music can be a great way to enhance cognition and recall, especially recall through music. So I take from that assessment, we determine what are going to be the goals that we're going to work on through the music. And then my job is to create opportunities through the music for that person to be able to address those situations or those goals. And that's how basically we look at the progress that they make from the time that we set up the goal to, watching them over time, observing them over time, and continuing to respond to the changes that take place. Because especially thinking of individuals with dementia, let's take that for example, there's frequent changes, as you know, that take place with someone who's in that process. And I might meet someone this week who is, able to respond verbally to everything that, we're talking about and we're singing about in the session. And then a few weeks from now, that's less possible. So one of the awesome things I need to make sure I talk about is the relationship, the therapeutic relationship that happens with the therapist and the client, because that's really one of the core facets of music therapy, that relationship, not only with one another, but with the music itself. It's almost like there's a triad of a relationship, because we all relate to the music differently too. So that's a little different than, it's similar to art therapy, for example, because there's the medium that they're working with that's also they're relating to. But in other disciplines, there's not that third party, so to speak, as there is with music therapy. So I don't know, did I answer your question? I kind of drifted off a little bit into other tangents, but.
How do you determine what music you use? And then the second part of that question is there certain musics or types of musics that are used for different types of patients?
Yes. Yes. Okay. So in terms of choosing the music, again, it's always going to be based on the uniqueness of the individual. So it's important that I get to know, when I can, what their interests are, because that's where I'm going to start. I feel that familiar music is often the best way to begin with someone, because when we hear something familiar, we immediately respond, we naturally respond, and that sort of warms us up a little bit and gets us in a better place for receiving therapy. There are times though when I don't have that information about someone the first time that I work with them. I'm thinking back to times that I would visit, not virtually, but when I would visit individuals like in a skilled nursing facility or an assisted living facility where they were receiving hospice care in that facility, and there wasn't a family member there at the time I would visit, and there wasn't a nurse who was free to come and tell me all about the patient. So and the patient perhaps was not able to communicate to me. So what I do is I think about their age first of all, and so if what age are they, and what year would they have been in, about their late teens, early 20s, because that's the music that we're going to remember. Keep that in mind. That's the music we're going to remember someday. That's going to stay with us the longest, okay? And so I'll start with some popular music from that period and see what the response is, and sort of gear my music accordingly. Then I also use improvised music at times. So that's music I'm just creating in the moment. And the reason I would do that, let's say working with a hospice patient who is maybe getting close to end of life and they're not really communicating too much any longer, but they're having a lot of fear around their transition and what's going on with their bodies. So if I don't know that individual and what their musical preferences are, I'm not just going to go in and place anything familiar, because we all have different associations with music. What's a beautiful song that you relate to, Pam, might be something that brings up for Linda something negative. Okay, we all have different associations. So if I waltz in there and I start playing a song that I think, oh, everybody's going to love that song, "You Are My Sunshine," perfect example. Okay, a lot of people love that song. A lot of people have negative associations with it. So what I don't want to do, especially with someone who can't say, "Hey, I don't like that song, stop." I want to be able to just share music that's going to be calming and soothing, but maybe doesn't have lyrics, doesn't have words that they're going to associate with. Okay. So music therapists have to have a very large repertoire of music that they can draw from. Mine includes popular music, obviously, from just about every decade, movie and Broadway music, classical music, country music, folk music, spiritual and religious music. I've been asked to provide music from all of those genres, and I'm sure I'm missing others too. But basically, we have to know music even from other countries, because I've had patients, only speak German or only speak French. So I have to, constantly be in a learning process too when it comes to music, which is something I really love. I love broadening that repertoire every chance I get. So that's really the kind of repertoire and how we sort of go about choosing music for the patient that we're going to be working with.
And Karla, so the second half of that, so what kind of responses do you see as a result of the music therapy?
Oh my goodness. There's so many. I think, can I give you an example? All right.
Sure.
Because sometimes I think the stories about those experiences really speak volumes. So let me tell you about a little lady, and when I say little, she was very petite, very petite, and she was residing in an assisted living that had a memory care unit. So she was in the memory care unit, and she was 92 years old. She was suffering from dementia, but she was still able to ambulate and make her way around, and she loved to take walks outside and with her walker. And first time I met her, her name was Ginny. I found her outside taking her little walk, and introduced myself. And of course, she didn't remember from the time I introduced myself to the time we made it back to her room to have the music therapy there. She didn't remember my name or anything like that in that short span of time. But she did allow me to come into her room to set up my piano keyboard and to begin to have some music with her. And she was really adorable, because she, when we got to the room, she mistook me for the massage therapist, because our hospice provided massage too. So she immediately took her walker over to the bed, kind of jumped on it to the bed in her own way, because her legs dangled off the side because she was so petite. And much to my surprise, she had a wig on, and she just flipped it off of her head and tossed it on the bedside table, because, like I said, she thought she was getting ready for massage therapy, and she laid down on the bed. And so then I told her she didn't have to lay down if she didn't want to, that I was just going to play a little music for her. And she said, "No, you go right ahead." So I started playing a song called "Fascination." And that's a song that's from the 30s, and I knew she would probably recognize it. Well, almost immediately as I began playing, she started to cry. So whenever I see that kind of emotional response with someone, I want to stop and check in, and make sure that it's okay to continue with that particular piece of music. So I stopped and asked her if it was okay. And she said, "Oh, yes, these are tears of happiness." And I said, "Okay." And she said, "Keep going." So I did. I continued. And at the end of the song, she explained to me what those tears of happiness were about. She said that she had been trying to think of the name of her second husband, who had passed away years before. And for years, she said, "I've been trying to think of his name, and I remember what it was like when we danced together and how much I loved him, but I couldn't remember until I heard that song." They used to dance to that song, and Fascination was a common song for in that era for people to dance to. And she said, "Now I remember his name." And she was just off and running about all the memories that she had of him and of that time period. So it is amazing. And that's just one story out of, I don't know, hundreds I could tell you about the response that people have to music, especially those who have dementia or, things that are impacting their ability to remember. The music it's like a time machine. It really is. It takes us back to an experience or a feeling that we had at the time of that experience, like nothing else can do. It really is so special.
What a gift you gave her. That is just, that's amazing.
Yeah, it really is the music. It's precious. It really is a precious gift that we have, music,
I know I've been asking a lot of questions, so I need to let Linda have a chance to ask you some questions. I just find this very fascinating.
Sure.
So, very interesting.
So a question in regards to when you develop these goals for them, how do you track the goal? How do you track that they've met their goals? Or if they haven't, how do you or pivot on the goals? I mean, what are the things that you look for in regards to meeting those goals or not meeting those goals?
Oh, that's an excellent question. I'm glad you brought it up because that's something that is unique. Well, not unique in a healthcare profession, but I'd like to make sure it's pointed out about music therapy that it is also evidence-based. So not only is there a body of scientific research that's backing up everything that we do and the choices we make about what we do, but there's also the measurement of what we see in behaviors and whatnot. So let me give you an example. Okay. It's more difficult with hospice patients, so I'm going to use a different example. I have a gentleman that I'm working with who has a brain injury, and that was one area I did not mention before. But yes, I work with individuals who've had stroke or brain injuries, and so I'm measuring things like his ability to recall certain facts. They're looking for him to increase his, I don't want to say reality orientation because he is reality based, but just his ability to recall facts. Okay, so let's say I'm giving him something. He loves Elvis Presley, so and he knows so much about Elvis Presley. So I will maybe develop. In fact, I've developed a couple of musical games for him that he really enjoys, based on other games, things like Musical Jeopardy and that sort of thing, where I'm asking him questions about different aspects of Elvis's life or Elvis's music or the movies and that sort of thing. And he's able to give me the responses. So very in a basic way, in a simple way, I'm measuring how many of those responses he gets correct over the period of time, okay, in the session. And then I'm going to offer him similar questions the next time, and we're going to see how much is his recall improving over time. Okay, and that is just such a basic way to describe it. But I do want to get the point across that we are measuring behaviors. Okay, and we are trained in behavioral therapy, behavior management, because especially with children and young people that I've worked with, we're looking at behaviors. hate to say this, but I had a child who was on the autism spectrum, and she spit all the time at people. Okay, she was constantly spitting at people, and we used the music to actually work on that spitting behavior because she loved music so much. I would stop the music when she would spit, and he knew if she wanted the music to start again, she had to stop spitting. So over time for her, we were measuring the length of time between when she would spit and stop and then start again, and it was getting to be where like she could not be spitting for the entire length of a song. And then maybe a month later, it was the length of a song and a half, or, so we saw an increase in the length of time she would not engage in that behavior. Does that give you a sort of an idea, Linda?
Yeah. So where do your referrals come from? How would someone get you a referral? What's your referral base for music therapy?
Well, that's a great question because I'm a new business. I've been doing this for many years, but I should tell you that Music Therapy at Home, my practice, which is completely online, virtually based, has been in existence for about a little over a year now. And I'm not used to having to seek referral sources because, of course, when I worked in hospice and other agencies, you get the referrals from the other medics. Folks, so I'm having to really reach out to be able to find referrals, for myself. And I'm finding really the most productive place is Instagram, really, which is where we found one another. And I found clients, actually, caregivers who've said, hey, I would love for my loved one to have music therapy, just because they're following the content of what I'm sharing and that sort of thing. So as time's gone on now, there have been some other companies, businesses that have connected with me and said, hey, we would love to be able to refer you to our clients. So there's starting to become more of that, but that's really what needs to happen, is that there needs to be an expanded referral base. Because right now it's a little scarce in terms of actually having consistency in terms of who's referring. Okay.
Have you worked, this April is Autism Month. And so have you worked with children and adults with autism? And can you tell us a story about your work with autistic children and adults?
Sure. Gosh, and it's been a lot of years. In fact, my very first job as a music therapist was working in a school for children with autism. And I just loved it. Of course, we know a lot more now about the autism spectrum than we did at that time. And I think the work then was very much behaviorally based. But as time has gone on, and I worked after that with adults with autism, again, we would be focused on behaviors and helping them to decrease sometimes the maladaptive sorts of behaviors, but also really doing a lot of work with increasing communication skills. And as you know, people with autism have a lot of sensory kinds of issues, and but communication is an area that I really recall doing the most work in terms of music therapy. And because music is such a natural thing for most people and most children especially, but a child who's very withdrawn and isn't interactive socially can sometimes be drawn out by the music too, which is a nice benefit for kids with autism.
Thank you. Yeah, I've noticed that that music it kind of crosses all barriers and all boundaries. Do you play a special instrument, or what instrument do you play?
I just happen to have my piano keyboard right here. I'll just share a little bit, very little bit, but just to sort of give you an idea of what it's like from your side to receiving it kind of virtually. But so I thought I would just do a little bit of Let It
My
Be.
Oh my
husband's
gosh.
favorite song.
I was going to say Linda's husband is a Beatles fan.
Oh, good.
My
All right.
husband's
Well,
favorite
sing along
song.
with me, okay? When I find myself in times of trouble, Mother Mary comes to me, speaking words of wisdom, let it be. And in my hour of darkness, she is standing right in front of me, speaking words of wisdom, let it be. Let it be, let it be, let it be, let it be. There will be an answer, let it be, let it be, let it be, let it be, let it be. There will be an answer, let it be.
Oh,
We
that
put a
was
smile
great.
on both of our faces.
Very good. I'm glad. That song has a way, I think, for a lot of people, sort of lighting them up and being reassured and kind of soothing. But I did, when you asked about, what instrument, that's I love my setup here is because I have my keyboard right in it. It's kind of built in under a desk, which is really neat. And I also utilize other instruments. I wanted to let you know I have some of them here. And it really just depends what someone might have at home. We use makeshift instruments too, depending what people have. But I use a lot of egg shakers, do some small drumming, tambourine, claves, things like that. Anything that someone can actually produce rhythm themselves with, okay? Because music is all about the interaction, right? And yes, singing is a wonderful thing and people love to sing along, but actually involving your body in the movement to the music or the creating of the music is just another level that it can take you to.
So Karla, when Linda was asking about the children and the autism, so when you're looking at a child and maybe they can't share, maybe they don't have a built up repertoire of music that they like, how do you choose the music for the kids?
Well, a lot of times with kids, the parents can give me an idea, but it's funny, through the years, nursery rhymes are the same as same now as they were 30 years ago. that hasn't changed much. There's some new children's songs that you want to bring into the picture, but for the most part, you can really rely on those simple, basic songs. And I'm thinking even of some children who have medical complexities that I've worked with who really are completely immobile. Maybe they have a breathing tube and all of that kind of extra stuff that goes with supporting their living. They still are able to respond to the music by having their heart rate maybe slow or their blood pressure come down. Music produces very specific physiological responses in our bodies, and for those children, usually I would maybe start with something like a Twinkle, Twinkle, Little Star, but very lightly. I don't want to startle a child like that. And but I would do a lot of improvisation too. Again, we have a principle, what's called the ISO principle that we work from, but in this sense, we use something called entrainment. So what I'll do is, and this works with not just children, but I've done this with hospice patients too, who are having difficulty breathing. What we do is we create music that is in sync with the rhythm of the person's breathing. So if it's rapid, then our music is going to have a rapid beat to it, and we're going to sync up with that breathing. And then once that breathing has been entrained with the music, then I can start to slow the music down, and that slows the breathing down and makes, the goal being, of course, for the person to be more comfortable and at ease with breathing. So that's just like one of the small ways that music on a physiological level can also be of help to people.
I've actually seen that work.
Have
I've
you?
actually seen that in hospice
Mm-hmm.
with a pediatric client. I've actually seen that work where the medication that they were giving was not calming this child as this child was going through transition
Yeah.
and needed to have something different. So the music therapist had come in and actually started, and I kind of thought it was odd because I'm like, why is your music so revved up? But
Mm-hmm.
basically she was trying to get in sync with that child's breathing,
Right.
and then once she did, she started bringing the tone and the sounds of the music down and softer and calmer. And all of a sudden, I mean, within minutes, that child was calm. And it had nothing to do with the medications. It had everything to do with the music and the type of music that the music therapist was playing. I mean, this is such an amazing gift that you have to give to people. It is truly amazing. And I am a true believer. I have seen it firsthand. I have seen how well it works. I've seen it with my uncle. I've seen it with pediatric children. And especially with this one, I was just amazed with
Oh,
how well that works.
I'm so touched that you actually had the experience firsthand, and that more and more, I think people are starting to see the value of music therapy
Mhm.
in different ways. And thank you so much for sharing that, because it really is a perfect example of how
Mhm.
effective music can be. Yeah.
Mhm.
Karla, we have loved this interview. This has been awesome, and there's such value. So we hope we can have you back again
Oh,
and
sure.
collaborate with our services with each other. And as we wrap up, is there something that you didn't mention, or what would you like to leave with us regarding the music therapy before you?
Um, I think something that I've come across kind of often, I'm afraid, as I'm interacting with people on Instagram, and people are asking about music therapy. A lot of people are mistaking. I have a misconception about music therapy being entertainment.
Mhm.
Um, and they're thinking that just listening to or participating in like a live performance, someone's, or a virtual performance, is receiving music therapy. And I just want to make it clear that while that could be a therapeutic experience for someone, for sure, not to minimize that. But it's not the same thing as having, a credentialed music therapist who does that assessment and who creates the goals and who helps you move towards the accomplishing of that goal.
Mhm.
So that's one thing I wanted to bring up. I'm finding that to be true, especially with caregivers who are caring for someone with dementia, for example, who say to me, "Oh, but my loved one's already having music therapy because I play their favorite songs on on Alexa plays their favorite songs for them, And while that can be therapeutic, especially if you're choosing songs that your loved one enjoys and are meaningful, then that's great. But it's not the same as having music therapy with someone who's trained to provide the interventions that I've talked about today. And we haven't even got into all of the types of actual music therapy interventions that we utilize. So that's just one little piece I wanted to throw in there. And then I guess the other one is how people can learn more, how they can reach out to me. If that's okay that I put in a plug for that. Okay. So my business is Music Therapy at Home, and you can email me at karlawilson@musictherapyathome.com, or I have a website that I just recently updated and would love to have people visit. It's musictherapyathome.com. I have a Facebook page and also an Instagram account. So I'm at Music Therapy at Home on Instagram. And I'm in the process of developing a YouTube channel because some of my clients have been so gracious with wanting to share videos that they've taken of their loved one having music therapy with me, and they want to share them with people. So I'm getting that going, and I also am going to looking forward to including just some music for relaxation and that sort of thing that people can utilize too. So that's coming soon. But in the meantime, please do pay a visit to the website and reach out to me. You can direct message me in Instagram or Facebook. I'd love to speak with anyone who's interested in just learning more or would like to speak with me about having a music therapy session. And I have to point out that the first session is free because I want people to have a chance to experience it. It's one thing for us to talk about it, but it's a whole nother thing to actually experience it. So that's what we're doing is a free first session to give people that firsthand experience with it. And then they can just determine from there, is it something that fits, for them.
That's awesome.
It is. That's absolutely awesome.
Thank you.
Thank you so much, Karla, for joining us. And again, we hope to have you back again. And for sharing all this information and for singing us a great song. So.
Yes.
Wow, that part was you're very welcome, and I loved every minute.
That was a bonus.
That was a bonus. Too bad my husband wasn't around to hear that. That's his favorite song.
Oh, you're kidding me.
No, he loves the Beatles. That was the one thing he remembers. If he ends up with dementia, that will be the songs he remembers is the Beatles.
Okay. All right. Thank you again.
Thank you.
Have a good night. All right. Bye-bye.
Bye-bye.